Welcome to Diaries with me. Today we have an interesting clinical case. A young child presents with ear pain and fever. Can you figure out the diagnosis before the reveal? A 4-year-old boy brought to the pediatric clinic by his worried mother. She tells us that he has had fever for the past 2 days and has been unusually irritable. Last night, he barely slept and kept pulling at his right ear. He is also refusing to eat and cries whenever his mother touches that side. What could be causing his discomfort? As we take a more detailed history, the mother recalls that her son had a common cold with a runny nose and a mild cough a few days ago. Since then, his symptoms have worsened. He cries more when lying down and has difficulty in sleeping. There is no ear discharge, no history of trauma, no hearing aid or foreign body insertion. Could this recent respiratory tract infection be related to his ear pain? Let's examine him and find out. On examination, the child is febrile and appears uncomfortable, but the biggest clue comes from the otoscopic examination. The tympanic membrane is erythematous and bulging, with loss of its normal landmarks and reduced mobility. These findings strongly suggest that the middle ear is inflamed. Are you beginning to suspect the diagnosis? Now, the question is, do we need blood tests or scans? Additional tests like pneumatic otoscopy or tympanometry may be used in certain cases, but routine investigations are usually unnecessary. By now, we have enough clues to make a diagnosis, but before we reveal it, let's see if you can solve the mystery yourself. Now, it's your turn, future doctors. Let's pull all the clues together. A 4-year-old child with fever, ear pain, irritability, recent upper respiratory tract infection, and a bulging red tympanic membrane. Which of the following is most likely the diagnosis? Pause the video, think carefully, and comment your answers below. We'll reveal the diagnosis in 5 seconds. If your answer was Acute Otitis Media, congratulations! The combination of fever, ear pain, irritability, recent upper respiratory tract infection, and a bulging erythematous tympanic membrane strongly points towards acute otitis media. In fact, acute otitis media is largely a clinical diagnosis and usually doesn't require extensive investigations. Now that we've made the diagnosis, how do we treat our little patient? The first step is symptomatic relief. Pain and fever can be controlled with paracetamol or ibuprofen syrup along with adequate hydration and rest. The first line antibiotics for acute otitis media is amoxicillin or ampicillin. Those allergic to these penicillins can be given cefaclor, cotrimoxazole or erythromycin. In cases where beta-lactamase producing H. influenzae or M. catarrhalis are isolated, antibiotics like amoxicillin clavulanate, cefuroxime azectil or cefixime may be used. Antibacterial therapy must be continued for a minimum of 10 days. Although complications are uncommon, untreated cases can progress to mastoiditis, tympanic membrane perforation, or even hearing loss. Fortunately, with timely treatment, most children recover completely. Before we end today's case, let's test your knowledge with a quick rapid MCQ challenge. Pause the video and see how many answers you can get right. Thank you for joining me on another case in Diaries with me. I hope you enjoyed solving this case. Don't forget to like, share, and subscribe for more interactive medical cases. See you in the next mystery. Happy studying!